Kia ora koutou, tēnā koutou katoa. I'm here with Sanjay Popat, who is a medical oncologist extraordinaire from the Royal Marsden, London. He's a thoracic medical oncologist. Sanjay was writing editorials for the world's biggest cancer journal when he was a registrar. So he's got some great chops as a leading researcher. Sanjay was also the lead author in the mesothelioma immunotherapy oncology study. So again, an internationally renowned clinical trialist as well as a translational researcher.
Yeah, delighted. Thanks for inviting me. I'm really pleased to be able to chat to you.
There was a lot of talk a couple of years ago about the influenza vaccine and whether or not that might actually give people additional side effects from checkpoint inhibitors in particular. And with your extensive experience in lung cancer, I mean, you must be one of the most experienced immuno-oncology physicians in Europe, Sanjay. Did you see anything personally with influenza vaccine, for example, seasonal influenza vaccine, and adverse events that you've picked personally? Have you seen anything like that?
Yeah, thanks. It's a really good question. I mean, when checkpoint inhibitors came out, it was a real open question as to whether we'd see more side effects when patients were vaccinated because of boosting the immune system and checkpoint inhibitors. The bottom line is no, we haven't seen much, and our internal audit data didn't show any increase in adverse events with influenza. And we've been using checkpoint inhibitors now for the last few years routinely. So our advice for influenza is to have the influenza vaccine regardless of what treatment you're on. We don't see any increased toxicities at all with influenza. And so when it comes to the coronavirus vaccine, we have exactly the same policy. Have the coronavirus vaccine if you're on immunotherapy.
You're using the AstraZeneca vaccine, the Oxford vaccine primarily, right? Can you just explain the particular? We're not using that one. We've got Pfizer and J&J is what we've got. The molecular basis of the AstraZeneca one.
Yes, the AstraZeneca one is essentially a inert adenovirus in which the spike protein of the COVID genome has been inserted artificially, and so the adenovirus goes within the human cells, and then the cells express the protein, and the immune system mounts a reaction to that. It's a very sort of natural way of developing immunity. We've been in the UK being given the Pfizer vaccine and the AstraZeneca vaccine, and really we haven't seen any particular major concerns with either with our experience. And we've now been vaccinating both our staff. Our staff all received the Pfizer vaccine initially, and more recently we've been vaccinating our patients as well, and that's been predominantly with the AstraZeneca vaccine because of the timeframes at which these have come through. We haven't really noticed any particular major concerns, and the regulatory authorities haven't noticed any concerns, and the specialist societies haven't picked up on any particular concerns.
And do you guys time the vaccination in particular in relation to the application of immuno-oncology or chemotherapy?
Yeah, thanks. A really good question. So a lot of debate has gone into this, and a lot of people have thought about this at length. And the bottom line is that we give it at the same time as any form of systemic therapy, apart from patients that are having chemo on the same day. So if you're having chemo as an intravenous infusion or a drip, we don't give the vaccine on the same day, and that's because of some previous data there is on influenza, which we've used as a correlate. But if you're on immunotherapy, you're on a long infusion or tablets of chemotherapy like capecitabine, it's fine to have the vaccine at any point. We have put some limits around patients who've had rituximab because they won't obviously mount an immune response. But otherwise, everybody who's on with solid tumours that are on systemic therapy at any point have the vaccine. Okay. I mean, obviously, if you're an inpatient, we have to be careful. If you've got an adverse event that's ongoing, you've got a problem with your systemic therapy, we don't want to confuse the clinical picture. If you're in, for example, with sepsis, we won't be giving you the vaccine. But if you're an outpatient coming along for a CT scan before your chemo next week, we'll grab you and give you the vaccine.
So it's been opportunistic in that way. You've got people as they're coming into the hospital to make sure they've had it.
Well, we've done both. We've highlighted our patients on our books who should get the vaccine, but we want to try and minimise their visits to the hospital because we don't want additional touch points. If you're coming anyway, we'll pick you up.
Right. So that's the timing of that has been opportunistic rather than the screening of them. And have you seen much vaccine hesitancy, Sanjay?
Yeah, I think people are concerned about that. I mean, to be honest with you, all the frontline medics have just been rushing at it, and it's been like, come on, let's get the vaccine and let's move on. We've got jobs to be getting on with. Whereas I think a lot of the non-frontline staff have had some concerns, and obviously patients have got some concerns. But I think once you speak to people and actually explain what the vaccines are about. And explain actually the risks of vaccines are pretty small and the risks of COVID are massive on a proportional basis. Then on that basis, I think most people really, once you've explained what the issues are, they go for it. I mean, people are naturally worried about things they are new and they may not really get their head around. There's so much tosh being circulated in social media and other channels. I think the most important thing is that we protect our cancer patients from developing coronavirus as much as possible, because actually is the best way of them surviving as long as possible.
So people have found that very reassuring. That's fantastic to hear. Oh, well, look, best of luck with the rollout of the vaccine and getting back to some semblance of normal. I know that can't come soon enough for everyone. Sanjay Popat, internationally renowned lung oncologist, a bloody good guy. Thank you so much for sharing your insights about COVID in the NHS, COVID in the UK, COVID and cancer vaccination, and how you guys have got through it and what's got people to survive this as well. Thank you so very much for sharing your insights with us over here in New Zealand. Thank you, Sanjay.